Hello everyone, and thank you Ian for the kind introduction. In this talk I will present results from our evaluation study of an ICT-based fall prevention system for older adults. We conducted a 6-month evaluation study at the participants' home, where we mainly focused on the appropriation of the system and how attitudes and practices of older adults change over time. So, our work was motivated by the fact that in the next decade there will be a significant demographic shift with a growing number of older adults in our first world societies. So 30% of this age group suffer at least one fall a year already, and this can be prevented by early and continuous physical activities. So research has been done around ICT fall preventive systems in the last years, but there is still a lack of research which we address in our study. So what have we done? We've designed a system that combines both ICT-based fall preventive training and continuous fall risk assessment, and we were looking at a long-term evaluation in the field to identify potentials and challenges older adults have with such a system. So this is the ISO4 system, which was designed in context of an EU project, together with participants in a co-design process. So if you're interested in this process, please have a look at the paper. And the system is designed as an IATV training system, which is with the idea that participants could do their exercises at home right in front of the TV. And so the TV is the central element in the system and is connected with a set-top box, with a controller, a mini PC, where the developed software is running on, as well as a Microsoft Kinect for movement detection, speech control, and gesture control. So the system is supplemented by an additional advice, which is the senior mobility monitor, which you see in the left figure on the right corner at the top. This was provided by Philips, and this device tracks the activity of the data from the person during the day. Nevertheless, the core of the system is still the Excel games, and they comprises 3 components. First of them are we designed 5 different strength training exercises. The second one are the balance games. Here we designed 3 different balance games with physical and cognitive tasks. And the third part or component is the fall risk monitoring tool, where participants can regularly detect their current fall risk by doing conducting several tasks. And we also used a specific feedback approach to make getting the user aware of their training or exercising results. Here we have 2 types, or used 2 types of visualizations. On the one hand, we have a pictorial, and on the other hand, a graph-based approach. The pictorial approach is mainly used after each exercising unit to get a direct feedback how the exercise was, and also for the fall risk, which you see on the colored smileys with green, yellow, and red. And for a more view on the historical data, we used a graph-based approach, where participants can see their assessment over the time, and it's also marked, if you look at the top right corner, also with green, white, and red, and you get a direct feedback: was this training unit a good one or a not so good one? So to conduct our 6-month study, we set up a user sample with 12 participants, where 5 were female and 5 were male. They were 65 plus years old, with an average age of 72.8 years, and we were very interested to have a more heterogeneous sample, so that we included previous fallers and non-fallers, but they were all without major chronic diseases. As one of the central requirements which we had is that participants had time during their everyday life for preventive training, so we recommended approximately 120 minutes exercising per week, at least 3 times per week. So here's an overview of our study's progression. We started the evaluation with 2 kickoff events where participants and researchers could get to know each other. And during the 6 months study, which is marked with the red frame, we gained several qualitative data, for instance, from 4 interviews with observations, 1 before the intervention started, 1 after 8 weeks, 1 after 14, and after 24 weeks of using the system. We also organized 2 workshops and a closing event during the study where we reflect on the participants' experiences. And we also gained some data from informal meetings, emails, instant messaging, and phone calls. And in addition to that, we also used some quantitative data, but more in a descriptive manner to qualitative statements. Here we used the logging data of the system, as well as what we have done is we measured from every participant the baseline assessment of their fall risk by using the PPA, one time before the study started and one time after the study ended. And for the data analysis, we applied a content analytic approach, and in an iterative process, we identify 5 central categories, which primarily focus on long-term phenomena in dealing with fall preventive systems. And these are the 5 key categories which we found, which has an impact on the use of the system, the exergaming habits, self-monitoring, fall risk control, and sustainable effect. And I will give you now more detailed insight. So for the use of the system, unfortunately, the recommended training schedule of 120 minutes per week wasn't reached by none of the participants. Nevertheless, the adherence to exercise and to use the system was good, but very diverse. So based on the activity level of every participant, we identified different types of users. So the first group is the very active, or are the very active older adults, which are marked with the red graph in the figure. As expected, they have a very high frequency of strength and balance games training. They exercised almost every day, and they could increase their overall daily activity. The second group are the active older adults, which are marked with the blue graph in the figure. They exercised as recommended 3 times per week, and here only the participants which were less active or inactive before, they could increase their overall activity. And the third group are the inactive older adults. They seldom used the system, but they regularly used the senior mobility monitor because it was just easy to hang it around. We also found some findings or interesting things regarding the sex ratio. So the group of very active older adults is dominated by females. The group of inactive older adults is dominated by male. Female participants use the exergames more frequently than the male participants does, and the males were more focused on strength training. Regarding age aspects, the balance games and strength training were longer used by the participants who are younger than the mean age of 73 years, and participants who are older, they slightly longer were the senior mobility monitor, but they covered less distance. So during the use of the system, also different kind of habits evolve for integrating the system into the daily routines. And participants always stated that they see it as a huge advantage that they can decide on their own when they want to do the exercises, and that they can do it at home. So every participant find a specific time slot when they always did their exercises, either in the morning or in the afternoon. And for them, it was really important to have it exactly at the same time at every day. So it's a kind of a motivational factor for them. What we also found out is that the ASOFOS partly or entirely substituted other exercises, and additionally to that, it involves an understanding that such a system should be a more holistic exercising approach, which is well described by the statement of one of the participants. I would like to see more exercises for future improvement. I'm not only thinking about legs and feet, but also about the shoulder, arms, and neck. So we also found some interesting insights regarding the user preferences. This is specific for the balance games. They were only or more seen as an entertainment factor to have fun doing or playing the games, but I don't see a real impact for their well-being. In contrast to that, the strength training was much more valued regarding a physical impact, so they force you to reach your limit, and training must hurt, which some of the participants stated. Regarding the exercise levels, it's a bit the same. So the lower levels are even described as boring and very comfortable, but the higher levels are more motivating. And the same applies to cognitive tasks. They were really highly valued, so they forced the brain for every day, and participants stated that they felt more comfortable and with an improved concentration. So when designing an ICT-based fault preventive system, different user needs should be addressed. So you should refer, or one should refer to gender-oriented design, and as well as a higher variety in strength training and balance games to maintain and sustain usage of such a system. Regarding the self-monitoring, we also found an effect that visualizing training results has a motivational factor for participants. And we also find a variation in the different kind of user groups. So, for instance, the very active older adults were just looking for competition and how they want to improve their own activity levels. In contrast to that, the active older adults were more interested just in their personal health status. So the visualization of both the rating of training results and showing the process of the training are valuable features for self-monitoring and help to motivate the user. So through our 6-month study, we could observe that the attitude of participants changed regarding by using the fall risk control. So we found out that they got an increased awareness of health, fitness, and fall risk issues. Participants felt more comfortable and confident and safe during indoor and outdoor activities. And based on the fall risk assessment, which we conducted before and after the intervention, we found out that especially the inactive and active older adults could benefit most to improve their fall risk. And as a takeaway for this, monitoring the own fall risk shows the same positive effects like the visualization of strength training and balance game results. And integrating such kind of fall risk assessment, in this case, or what we have observed is that it can help to increase also the awareness of the IT literacy. So the last point are the sustainable effects. Here we found that using such a system over a longer period of time has an improvement or a positive impact on the participants' well-being and the self-esteem. And they also, from a more subjective, reflective level, they felt a mental benefit through the improvement of concentration. So monitoring data helped to create new confidence in older adults. And two more findings are that the first one, I mean, it's obvious that when dealing with technology, the confidence using such IT stuff increases. But the other one is the much more interesting one. So fall prevention has a really positive effect on an increased activity and social engagement of participants. So especially the active and inactive older adults shift their attitudes and social engagement. They become more aware of the importance of physical activities and their influence in their social life. So one participant stated, "All I know is that since I'm doing the exercises, I'm much more aware of how important these bodily activities are. Activity and mobility are of pivotal importance." So to conclude, not only training, but also the social exchange and the influence, the social exchange are important for older adults as well. So we suggest a combination of both, a home-based training and the monitoring of fall risk together with a regular physical group class training. And this would be the best fitting solution addressing the upcoming demographic shift in our societies. And with this fact, I want to conclude, and I'm happy to have your questions. Thank you.
All right, Corinna, I'll get started. So of the 12 participants that you had, were any of them kind of actively tracking their health before this? like doing any kind of this quantified self-health tracking at all, or were all of them kind of new to it?
Unfortunately not. I mean, maybe it could be the reason why the study is a bit older. So we conducted this evaluation study in 2014. And I mean, these health tracking devices were popular, but not so in this target group, yeah.
Yeah, awesome. The other thing I wanted to ask was about some of the sustainability stuff that you just addressed at the end of the presentation. So you guys kind of deployed this system over the course of 6 months, which is a very long-term kind of study. But for these older adults, especially over more of the course of like years, there's likely very large changes in the range of ability and that kind of thing. So did any of your participants talk to you about, concerns about how their ability to do the exercises might change over time, like in the long run?
Yeah, maybe this is a good example. There was one participant, she really loves doing the exercises, and she was also a participant which was very active before. She was playing tennis, going for a walk every day, and she always do some other exercises in the morning. And she always missed the system when she's got abroad, or when she goes abroad, or did everything else. So this is what she missed, and also some of the participants stated that they want to do more and different exercises. So is this what your question answers?
Yeah, well, I guess my concern is for, like, as participants get older and have more, like, injuries, you started with a particularly healthy group. And so were any of them concerned about, like, keeping this as part of their routine, maybe 5 years in the future or 10 years in the future, anything like that?
I mean, there's a thing, especially for the strength training, there are several instructions that help you. You can use a chair at the beginning to do the exercise, that you feel more safe when doing the exercise. And if you feel more comfortable and safe with the exercises, then you can put a chair away. And so the assessment, is it the assessment? Yeah, so the assessment.
Gotcha. Yeah, so just making it, like, appropriate for a range of abilities. That's awesome.
Yeah.
Okay, great. Well, let's thank Corinna again.